Well, hundreds of physiatrists are meeting in Victoria this week as they discuss the latest breakthroughs in physical medicine and rehabilitation. Now, if you have never heard of that medical specialty, you're not alone. Physiatrists work with patients who have suffered brain injuries and strokes, amputations, and chronic pain. Mary Beth Burton has their story.
You'll have to look closely to notice 48-year-old Tony Diotte has trouble walking on his right foot. He was the victim of a life-changing car accident in 2008. Tony suffered
a spinal cord injury and a broken neck, and it's been just a long, it's been a long, dragged-out process.
A big part of the recovery has been Tony's physiatrist, who injects Botox in Tony's right arm and leg every 3 months. The Botox helps relax muscles in spasm. The improvement in Tony's pain level?
70% better after.
Physiatrists have been around since the end of the Second World War.
And the goal that the specialty adapted was to maximize function and restore ability.
32-year-old Craig McKinnon had a benign brain tumor removed in 2005, but it's his foot that suffered the long-term effects of that surgery. Years later, he learned of physiatry and saw immediate improvements. Every patient has his own treatment program depending on the severity of their medical issues.
When you meet someone early who's just had a major, say, car accident, who's had head trauma, they might not be able to sit up, swallow, eat, feed themselves, or speak. So their goals are massive. For people who have a chronic injury, we go through their barriers to living independently as best they can.
Physiatrists were holistic pioneers working with other healthcare providers like physio and psychiatry in order to achieve the best outcome for their patients. As many as 200 physiatrists are attending the conference here in Victoria, and 9 of them make Victoria their home. Matt Bridgen from Port Alberni had a stroke at 21. He volunteered to be a demonstration subject at the conference. Pediatric physiatrist from Maryland shows how ultrasound can help better guide Botox injections. The wait to see a physiatrist is 2 to 6 months in Victoria. The conference on physical medicine continues until Saturday. In Victoria, Mary Beth Burton, A News.